is my guest tonight. I know we did not want to talk about SHA, but we have found ourselves talking about it. Whether it is working or not, it is for you to go out there and experience, but Madam PS says it's working. The president himself says it is working, of course, in the teething problems, just, trying to jostle around and see whether it works for the people. We can only wait to see. PS, allow us to shift gears. Or there's something you wanted to say about that? 1 minute.
Because
1 minute to that. Yes, proceed.
You are using words which are pushing.
Okay.
Number one, we are not going to wait to see SHA working.
It is working.
It is working.
Okay.
So I want to confirm that. It is working. And I want people now to go to specifics. Tell me which facility, where it has not worked for you, who attended to you, so that we are able to fix issues. Even you, if you start a project in your home area or even here in town, there are those places, whether it's a building you have built, there are those areas that you'll keep fixing every now and then. And it's continuous, continuous progress.
I can tell you my phone is ringing, And I know all these people want to ask something to do with SHA. Please, the lines are on your screen. In case you would want us to answer or the PS to answer something, we have the lines, the office lines that are on your screen. Please make sure that you use that channel so that we're able to speak to you and project your voice as well. I want us to hear something about the position of community health initiatives that were introduced to advance Afya Mashinani. I think I remember I was somewhere when, of course, the event was happening and the commissioning, and this was made known to the country as well, the coming in of community health promoters. I have personally hosted a couple of them here who are very appreciative of what the government has done, but are questioning that in as much as the government has done this and that to make sure that we are compensated, at least we get something out of it. We really do not get, what it is, the tools that we want to use on ground actively so that we can enlighten the masses on the very many things and the very many new policies that are being presented by the government. Just what's happening down there.
Okay. First and foremost, if you look at where we are coming from, the launch of universal health coverage some 2.5 years ago, and the introduction of SHA that we have just spoken about, that replaced SHIV, the rolling out of a social health insurance fund. Then we had the community health promoters. These are just the highlights of the achievements that I can talk about. The rolling out of the community health promoters was a game changer, is still a game changer. 107,831 community health promoters, and their work is very basic at the bottom of the pyramid, checking blood pressure, blood sugar, reminding mothers and caregivers to take their children for vaccination, ensuring that mothers go for prenatal and postnatal care, and ensuring that mothers go to give birth in hospitals, so that they are taken care of by a skilled workforce. And of course, checking common childhood ailments at the community level. Talk of diarrhea, and advise them. As at this evening, we have had our community health promoters having assessed 36 million people for diabetes, that is blood sugar, and 24 million people for blood pressure. And out of that, they have sent or they have referred more than 400,000 people to a health facility for further assessment. That means there are people who are going on with their normal lives. They didn't know they had diabetes. They didn't know they had blood pressure. And they are taken their vitals and they are referred to a health facility for further assessment. We, as a government, we have increased focus around preventive care. That is why the community health promoters exist. They have a kit and they have a phone. a smartphone, just like that one of yours.
At that time of trying to help people register SHA, there were lots of complaints from them. But anyway, I can only hope that they've been sorted.
Yes. That time it was a different story because of whitelisting. Because again, if they had to register, sometimes they had to use data, their own data. But that's something which was sorted. So we are focusing more on preventive care, just to ensure that we have people and education at the bottom of the pyramid.
Okay.
The community health promoters' work is basically that. Each community health promoter is assigned 100 households. And each community health promoter has a phone that they collect data with. Initially, the community health promoters never used to be paid. Even my own sister used to be a community health volunteer. And she never used to be paid. Our own house used to look like a small clinic because you had GV and all that, bandages, a first aid kit. So the same, but this is an improved version of the community health, the community health promoter, because they have a kit. The kit has commodities and equipment for work, tools for trade. Number two, they are paid, at least a stipend, something to say you have done well.
Oh, thank you.
Okay? And this is something that never used to happen from time immemorial.
You know what they tell me?
Yeah.
Most of them, like you say, they used to do this without being paid. Their satisfaction comes with building a connection with some of these patients that they are working with, and to actually see them walk the journey of managing their conditions or even getting well.
Yeah.
I speak to a majority of them on ground, and they say that if there is something that needs to be escalated, the first places they would go to is level 3 and level 2. One of them tells me today that facilities at level 2 and 3 are closing down because SHA is not working at the level given. SHIF funds start at level 4, while PSC funds seem to be insufficient to cover primary health care needs, leading to ridiculous low benefit package. For example, in 2,000 for dental per family per year. What would you say about this?
About the closing down of the facilities, maybe I would want to know which
facilities.
Yes, because let's not generalize. I have said on issues SHA, we must stop generalizing because we know there are those places that it is perfectly working. Number two, the facilities are getting capitation. They are getting reimbursed for the patients that they have already treated. It would be important, and this is what probably we should have discussed first about the laws that we came up with in 2023. I should have taken you through the 4 laws so that as we come to that question, we are able to understand that the committees that are supposed to run those facilities come from the community itself. It is you and me who come from that community, representative of women, representative of youth, representative of the religious leaders. So if the facility is closing, then the committee is not doing it.
There's a problem,
because they are supposed to do the oversight. When they get that money, they are supposed to sit down and budget. What do we require? So why would a facility be closing if your money has been paid? We have facilities that have received incredibly higher amounts of money than they have ever received in their existence, you see? And if they have received more money, then they are supposed to plan for that money, to know about improvement of infrastructure, employment of healthcare workers, commodities, so that people stop saying we do not have drugs in the facilities. And equally, taking care of patient safety around the facilities. Therefore, it would be important maybe we go specific on those facilities because probably they are also operating above their ability.
Okay, like you had earlier mentioned.
Like I had earlier mentioned.
This specific
and
person is from Machakos,
let me just go back to the laws that we set up we developed in 2023.
As long as we make them tight, so that you can answer these numerous questions.
Yes, no problem.
Yeah.
Even if you want me here tomorrow, I'll come back and answer the questions. Otherwise, public health is so huge, we may not finish everything tonight. So number one, we came up with the Digital Health Act of 2023. That is why our community health promoters have gadgets. Initially, they would carry very heavy books going around the villages and checking people. You know, today it's just a dial of the button, and they are able to record your name, record your vitals, and send, you know, in which that is transmitted on my desktop. And I'm able to know how many people have been assessed today. I've given you data. This is real-time data of 36 million people who have been screened for diabetes. And 457,000 of them have been referred to a health facility for further assessment. On children, 9 million children under the age of 5 have been assessed, or they have come into contact with a CHP. So this is data, real data. So Digital Health Act was to help interrelatability of data. And right now we have digitized all our facilities, whereby you don't have to repeat your stories from one facility to the other.
Can I ask a question in line with that? So that, I'm sorry, it's because I want us to tackle data and then move to the next one, so that we don't have to go back to the question that I have. Now that you're talking about the same, how will you ensure that patients get the right medical professional contact at first, you know, or maybe professional at first contact? Because then, for example, how will you ensure that an expectant mother then goes ahead to meet an obstetrician, do they call them that way, at the first contact, so that, you know, you ensure that they get the highest standards of care, you know, because there's a lot of mismanagement that is happening.
Health professionals have their levels of operation.
Right.
You don't expect to find a CHP in level 2.
Without doubt.
Okay?
Yeah.
Because their work is at level 1.
And they know it.
And they know it. You will not expect to find maybe let's say who?
A dentist in a different...
Not even a dentist. You don't expect to find...
A clinical officer.
No. Clinical officers are at all levels.
All day.
But you don't expect to find operations being done at the lowest level of facilities in level 2. Okay? Level 2, you'll find either a nurse or a clinical officer. Because even the equipment in level 2 are basic. All right? So that is how referral system works. At level 4, that is when you probably will be admitted, because maybe of complications, because it is secondary facility, and we can go to even further to check further diagnostics for somebody, depending on the kind of ailment you have been prescribed. Therefore,
no cause for alarm.
There is no cause for alarm at all.
Okay.
At level 1, you will find the CHP in the villages. And they are simply just checking. Are you okay? You know, they'll find out if your children are okay, if they are malnourished, if they need some vitamin, you know, and they'll be able to dispense of the same.
All right.
And then if you go to the facility, then you expect a more skilled person, like a nurse, who can take your vitals again and refer you to a doctor, possibly. Yes.
Okay, fair enough. That was on the digital. We want to talk about finance?
Yes. Digital Health Act of 2023.
Okay.
Then we have the Primary Healthcare Act of 2023 that takes care of the mashinani facilities, or the level 2 facilities and level 3. Yeah. Again, they also touch on the CHP. Remember, the CHP right now, their role is entrenched in law. So we are able to know what exactly does a CHP do. What exactly will you find at level 2 or level 3? So at the Primary Healthcare Act. Yeah. We also have something called the PCNs, Primary Care Networks. A primary care network is geographical mapping of facilities within the same locality or the same geographical area. That is why when you get into SHA, there's a list of facilities that comes on your screen.
Okay, you're advised you can use these.
I don't know if you have registered.
I have.
Okay.
To be honest, I
then
have.
you must have come across the facilities that are in your area, and you're told you can choose your primary facility. So that is the primary care networks. And already we want to have 315 PCNs across the country. Number 3 was is the Social Health Insurance Financing Act of 2023. And the Social Health Financing Act of 2023 is the one that holds SHA. The SHA is the authority. It's actually the house that houses 3 funds. And one of the funds is the Primary Care Fund. The Primary Care Fund takes care of the primary care facilities. The level 2, level 3. That is why you're not supposed to pay if you go to those facilities, because it's exchequer funded. Then we have the Social Health Insurance Fund, which is a harambe between me and you and members of the public.
Right.
We pool resources together. Then finally, we have the emergency, chronic and critical illness. Initially, you'll find you have accidents, you're taken to a facility. Before you give a deposit, you cannot be admitted. That's a thing of the past, because everybody has to be treated equally, whether you have an accident or you have gone because of flu or any other. We are looking forward to having availability, accessibility, affordability, and acceptability of quality healthcare across the country. And the
what
final
about
one,
utilization?
the final act, let me finish. The final act is the Facility Improvement Financing Act of 2023. This is to ring-fence funds that are meant for health. You would see initially when budgets are read, and within the year we reallocate, and it's taken to roads.
Yes.
There's a bridge that has been swept away, and we take money for health, and it goes and constructs a bridge. Money meant for health must remain in health, whether from exchequer, or it is donations, or somebody has decided, now I'll be funding health. All that money must remain there and must be budgeted accordingly in the health sector. So those are the 4 acts that we first came up with, because every structure has to have a base. And if you have a base which is weak, then even in the future, that house will give you problems. And that is where we are adding the quality of healthcare and patient safety bill. Because we realized we did all that about infrastructure, money, a healthcare workforce, digitalization, but the patient has not been mentioned anywhere.
All right.
The quality of care that is given to that patient. Are you going to come out of that facility happy, or you're going to come out of there saying, oh, daktari hata mimi sirudi hapo tena?
Well, fair enough. Lots of questions. I don't know what we're going to answer to or not.
Put
now that
them
you mentioned
together,
donor,
and I have told you, and I've told you I will
back
come
tomorrow.
Yes, even if you want me here every day.
Easier said than done. You'll be in I don't know what county and all that county.
No.
But anyway,
but
we have correspondence.
Yes,
across.
you have correspondence across the country.
I agree.
So I'll be ready to answer questions.
This is a question that, on the question of USAID, now that you mentioned donor funding, how is the government planning to ensure normalcy, especially for HIV and TB programs? I know I have also hosted officials from the health sector, and they have confirmed that all is well. Is all well? Is that what you can confirm?
All is well. There's no cause for alarm.
All right, no cause for alarm.
And nobody will go without being treated or without drugs for HIV, for malaria, for TB, because we have to repurpose and ensure that we are restructuring our programs to align, and also do a bit of also reallocation to factor in. The government has also gone ahead to ensure that we are allocating funds towards that. we are also open to allies.
Well done. All right, well said. I have very many questions from the interns, who are asking, ask the PS, what is the fate of the 400 nurse interns who are unjustly and unfairly not part of the internship list? And I'm telling you, intern questions are like 60 of them. You might need to respond to that. Another person is asking, ask the PS whether the digital tracing in health facilities is connected. Reason being, a patient who reports at level 2 and 1 and 2 get the attention from level 5 or 5 without telling the members who deliver the patient. This way, the services of the ambulance is readily available. I think it's just basically on the connection all the way up the tree. You can respond to that, yes, first before we get to the next.
Okay, the question of interns, tell them we are telling them that issues to do with healthcare workforce, we are handling it.
Okay.
And we will handle from end to end, from college to postgraduate. Okay. And you can see a lot of issues have really gone down right now. You are not seeing the mini strikes that used to be there because we have engaged consultation and conversations. We will no longer be doing things haphazardly. If it means to sit down with a cadre so that we can discuss issues and that are surrounding that cadre, then we will do it. So even the issue of interns, they should first be very happy because we have been able to post the interns in good time, at least as promised, And my CS is working very hard to actually see that this issue of internship, perennial problems around internship, is going to be a thing of the past.
Because our time is almost out. Preventive and promotive is
I've not even said anything.
Hold your pace, Preventive and promotive health services that sit under your docket. Could you please just allay fears without getting into the details of all this talk about, we have this vaccine coming on board, we don't have the confidence about it, without getting into the details? Or if you want to get into the details, we'll be happy as well to hear from you.
Any vaccine that is given to people in this country, whether it is vaccinating young children or vaccines for grown-ups, is safe.
Okay.
As long as it is coming from the Ministry of Health, it is safe. And I'll tell you, because I have seen in the past parents coming out and saying, oh, my child reacted. People react differently. And that's why we encourage, if it is vaccination for children and your child has reacted, don't first pick your phone to rant on social media. Rush the child to hospital. Right. Because children react differently and also grown-ups may react differently. So the remedy is to ensure if you have rashes or anything, then go to hospital you'll be treated.
Well said. In your parting shots, I want you to tell us what you feel about the performance of the Kenya Kwanza regime now that you sit in it, 3 years and counting, and what should Kenyans expect?
We have finished the show.
We have finished the show, that's like that.
Really, as part of government, we have done the very best. And the promises that have been made, we have achieved a lot, and especially in the health sector. We have achieved a lot in terms of insurance cover, ensuring that everybody accesses care. The universal health coverage is key to every human. And we are not doing Kenyans it's not a privilege, really. It is a right, okay? So we are doing this because it is in the Constitution, right, to make sure that everybody accesses care. Everybody is able to afford care. Everybody is able to get quality health care as it is enshrined in the Constitution. And we ride on the word Kaizen, as Japanese said, continuous improvement. We may not achieve 100% at a go, but I can tell you for a fact, this is a game changer for the whole country and for the citizens of this country.
PS Mary Muthoni, thank you so much for your time. And of course, we're looking
But
forward to
may I
hosting
remind,
again and again. Yes.
You know, being the public health PS,
right.
I always like reminding Kenyans, please wash your hands.
Right.
Personal hygiene is paramount.
It's critical.
Because most of these ailments that we have in the society are actually very basic, and they come because of that. So personal hygiene is very critical. Environmental hygiene, with climate change issues, the extreme weather conditions, whether it is more rain or more heat, is a problem.
Right.
And again, water and sanitation. Our country still has about 15 counties that practice open defecation. It's going to be a shame in the 21st century that we have people who have no latrines.
We hope the government is looking into that.
Encouraging everybody, every household, at least to have a latrine. Right. I am happy with the housing program because some of those people who live in slums will be upgraded in other, in better houses where there's a toilet and sanitation is going to be managed better.
All right.
Therefore, personal hygiene, environmental hygiene, water and sanitation.
It begins with you, Principal Secretary for Public Health and Professional Standards, Ministry of Health, Madam Mary Muthoni Muriuki. Asante sana.
Asante pia.
All right, let's take a break.
Nikuje kesho.
Nitakupigia simu utaona tu. Tena nitakuja hapa kwa TV kuambia watu alisema atakuja lakini amesema ako busy. All right, after the short break we come back with more news.
Okay.
Thank you.